and the consortium coordinator for LA's Best Babies Network. And I'd like to welcome you to our Medi-Cal coverage and resources for home visiting staff today. I hope everyone is staying dry. I'm going to be introducing our speaker, Liz Ramirez. I'm going to read a brief bio on her and then we'll get started. Liz Ramirez is Director of Training and Education for Maternal and Child Health Access. Her work focuses on health policy, benefits, eligibility, and advocacy for clients facing access to care issues in both public and private health systems. Liz has led the MCHA's efforts on the Patient Protection and Affordable Care Act implementation of Los Angeles County. She has been committed to the issues with health care access for over 25 years. Please give a welcome to Liz Ramirez, our presenter.
Good morning. Good morning. Thank you so much for being here. I'm super excited. As we huddled before the beginning of this training, I was saying how I never thought the day would come where I would see kind of health for all. So again, Liz Ramirez with Maternal and Child Health Access. Last November, I celebrated my 20th year with MCH Access. Maternal and Child Health Access is a nonprofit agency that was started about 27 years ago by our executive director, Lynn Kersey. And she hired a staffer to help with administration, and she was charged with dealing with the issue of people having delays in their prenatal care. Because back in the early 90s, you had to have an approved Medi-Cal case before you could access care. So our executive director worked on policy that created the presumptive eligibility for pregnancy program within Medi-Cal. Super easy to access. I think I'm pregnant. I go to a PE provider. I self-declare my income, so I don't even need to take in proof. And I sign a form that I'm a California resident because that's a requirement to be eligible for Medi-Cal. They give me a pregnancy test, and if it's negative, then that it's taken care of, the pregnancy test. But if it's positive, I then have some immediate access to healthcare. It's not comprehensive, and it's only outpatient, and it gets your foot in the door while you apply for Medi-Cal. So that's the kind of work that kind of kicked off this agency. Always been a training component as we realize how difficult these programs are to navigate. So thank you very much for being here. Like I said, I'm really excited. We've got some things that have changed in 2024 that are amazing. I'm going to throw some really complicated stuff at you in one slide. I try to keep it because I just wanted to demonstrate how confusing Medi-Cal can be and to kind of highlight why our clients fall off. I mean, there's not a lot of logic within the program. So we want to provide you with referrals in your area that have different language capacity. So want to provide that for you because this is a world that many times there is no logic. If you have a question, please feel free to put it in the chat and they'll let me know. So I'm going to talk about the expansion of full scope Medi-Cal. There was an asset elimination, and I'll talk about what was in place briefly last year and how it's eliminated and which target population this rule applies to. Every year, the federal government adjusts the federal poverty level. And so I have the new 2024 federal poverty levels for you to look at, but they're not programmed in the computer yet. There's always a delay. So many of us are part of this community health outreach initiative. We call ourselves CHOI navigators. We've been doing this work together as a collaborative since like 1999. So we've been doing this a very long time, has seen a lot of change. The CHOI contractors are required to take my training and keep updated. And we may not have all the answers, but this collaborative really works hard to figure out what is the policy, how should this be working, because many times the way the policy is written is not the way it plays out for our clients. So in my training, I really do try to like highlight areas where things can go wrong and provide like tools to help folks overcome that. We just coming out of a public health emergency because
Ya pude.
of COVID, and renewals were paused, but they are back. So I'll kind of run through who that started for already and kind of the good work that's been done as part of the state's ability to apply for federal waivers during this, what they call the continuous coverage unwinding. So there's some really good federal waivers that were activated for people doing December renewals, Medi-Cal renewals. So, health for all. So I'm going to go backwards. So in May of 2016 was the first implementation of health for all. So advocates, children's groups, folks that care about healthcare started to push this health for all that said, let us use state dollars and cover. We started with kids 0 to 18, giving them full scope Medi-Cal coverage, regardless of their immigration status. So all the other rules apply. They still had to income qualify. But if they were eligible for Medi-Cal, we used state dollars, and beginning in May of 2016, we started providing full scope coverage to kids under 19. Then we had to rally. You see that there was like a little time gap because the young adults didn't really push forward until January 2020. So beginning January of 2020, young adults between the ages of 19 to 25 who were otherwise eligible for Medi-Cal. So I think that's a big misconception, is that everyone's just getting it. You have to income qualify, and we'll look at the income levels in a bit. So in May of 2022, we increased that to adults. So over age 50, full scope Medi-Cal, but had to otherwise qualify. So for a while, we were running this little gap of 26 to 49-year-olds. And that's the gap that we closed beginning January 1st of 2024, that 26 to 49. So what that means is now that anybody who's eligible for Medi-Cal, so you have to be eligible, they're going to be eligible for full scope Medi-Cal coverage, comprehensive coverage. Medi-Cal is really, really good coverage. It will cover what is medically necessary. It doesn't mean they easily offer it up, right? Because our folks have to deal with systems, and there are processes within Medi-Cal to get things covered that are not routinely covered, but really, really good coverage. What does that mean? That all of your clients In Medi-Cal or in MCAP or in Covered California, they're all going to be in managed care. Okay, so working within a network. In Medi-Cal, we're going to look and see that Medi-Cal is like a house. There's different rooms in this house that target different populations, different income thresholds. So in Medi-Cal, if you income qualify, your income is, if you're over 19, below 138% of the federal poverty level. We're going to look at the income chart in a minute. But we have clients who qualify based on their income. Now, everybody's going to be in managed care now with this Health for All expansion. So packets coming. We're going to look at that in a second. There is a consumer protection built into Medi-Cal that says you can't kick this person off Medi-Cal while they're pregnant or 12 months post-pregnancy. But since this group here who income qualify, their Medi-Cal room is not specific to pregnancy. So they must report the pregnancy to protect the coverage, right? We had a client who got married. All of a sudden, her husband's income counted and they wanted to move her. Our advocate got involved and because the client didn't report the pregnancy. We reported the pregnancy in that moment, and we were able to keep the client in Medi-Cal, not only for the until post-pregnancy 12 months. So having a baby, having an abortion, having a miscarriage, that gives 12 months post-pregnancy coverage that is protected from increases of income and losing coverage. So that one, I would just say when you have clients who had already had Medi-Cal and then become pregnant, asking, did you report the pregnancy? Now, we have another Medi-Cal room for pregnant people whose income is above the 138, and the only reason they are getting Medi-Cal coverage is because they're pregnant. So this program goes to 213 of the federal poverty level, so more than 2 times the federal poverty level. And the only reason this person got Medi-Cal is they're pregnant. So 12 months post-pregnancy, if their income is still above this limit, they lose Medi-Cal, right? So 12 months post-pregnancy coverage, these people are going to lose coverage unless their income dipped under this amount. The person with satisfactory immigration status, so U.S. citizen, qualified immigrants, people who are lawfully present, that's going to open up a 60-day window to enroll in Covered California. If they do not enroll in Covered California, that window closes, and unless they have another special enrollment reason, they have to wait for the next open enrollment that starts in November for coverage the following year. Now, people that are undocumented that have this higher income threshold, they are specifically excluded from purchasing within Covered California, even at full price. And that's DACA folks as well. So if they miss the 138, they're not going to be able to go into Covered California. But in LA County, because of this expansion, our Department of Health Services at LA has increased the federal poverty level to receive free care at county. It used to be 138, but they have money now because of this full scope for everybody. So what they did was move the ability to pay program that's offered at the county. If your income is below 200%, you can get free care at the county. So that's an option for folks who have higher income than Medi-Cal allows, but they're unable to purchase within Covered California. Okay, so I see a question right here. Thank you for your question. So stated over 19 and after 19 and up to, will they no longer qualify under parent? So I'm going to talk a little bit about how we look at people's family structures, just really briefly, because it's more confusing than income. You can believe it or not. It depends on if the parents are claiming their child as a tax dependent. What demonstrates proof of income? Everything from check stubs, income tax, to a self-declaration that someone jots down. I make X amount of money, per week or per month. Medi-Cal will accept a declaration. So thank you for your questions. I just put this here so you have the info. DPSS must know that the client's pregnant, specifically those that are not in a pregnancy Medi-Cal program. So Benefits Cal is an account that can be accessed and created also to see information about the client's case, and can report a pregnancy. And we have a customer call center, 866 number. Covered California, you do not have to be eligible for Covered California to create an account, and Covered California and Medi-Cal, they talk to each other. So you could even create a Covered California account, report the pregnancy. And in LA, we're really lucky, and I'll talk a little bit about this, and you will be getting a handout. In LA County, if mom had Medi-Cal for the delivery, the babies are deemed eligible, need to be treated as if they've already applied. So notification is all that needs to happen for Medi-Cal. Now, rules vary for CalWORKS and CalFresh, but I'm talking Medi-Cal. They just need name of the baby, date of birth, and gender. Now, in LA County, we have a special infant registration line, and they are going to send you this flyer in English and Spanish. And it's a lot less of a wait time than calling the customer call center. You do need to have parents on the line. I asked the trainer we have, and she said the last time she called, it was 20 minutes. So she stays online with the client. And the beauty of this infant registration line is that you speak to a live person. And when mom hangs up or parents hang up, they have the baby's client identification number, the SIN number. So that, for me, when babies are born to moms on Medi-Cal, getting their baby their own card, I would use the infant registration line. That, I think, is the best way. We used to have other methods that used to work better. Like there's a form, the MC 330, the newborn referral form, and it used to work a lot better. They used to add the baby where they received the fax because it only went to a central location. And then some years ago, they no longer add the baby. They forward that piece of information to the district where mom has her case. So things were getting lost. So I don't recommend it anymore. In LA, we're lucky we have this direct line to DPSS to add a baby. And that should also, we've also, did you report you're pregnant? No. So when we do the infant registration line, we were also having them note in the case that mom was pregnant. Okay, so what role do hospitals play in getting parent registered after birth? Well, that's going to get tightened up based on legislation, but it was really at the discretion of the hospital. Right? So pretty soon, this hospital deemed eligibility pathway is supposed to be happening. So it should be getting better because you would think hospital makes sense. Let's get them on. Many times what they do is they put the baby on hospital presumptive eligibility, which we really don't want to do that because we want to save it just in case. So I just want to remind folks that mom can use her Medi-Cal card for the birth month and the following month to provide services for the baby, because baby's not going to have their card. So if I delivered today, Liz can use her Medi-Cal card for her newborn for the rest of February and all of March. Okay. Covered California has the ability to create an account asking the computer is the same Covered California as some of the Medi-Cal programs. So in Covered California, you report a change. What's that change? I'm pregnant. And it will rescreen to see. And next, so if that house, what if mom's case is in LA County, but has an emergency delivery? So in an emergency, and being in active labor is an emergency, you go to the nearest emergency room. We're going to report the baby, and the baby's deemed eligible, guaranteed 1 year of eligibility. It means the baby's covered by mom's card for 6, well, it depends. Birth month and the following month. So if I have my baby mid-February, it's not going to be 60 days. So it's for the rest of the month in which the baby was born and the next month. So it could be 60 days if it's at the very beginning of the month. Good questions. Well, you're not making changes to Covered California. You're reporting a change in the system that also goes to Medi-Cal. Yes. Thank you for your questions. And I think I've said this multiple times. So Medi-Cal and MCAP. MCAP is a program for people with higher income. It goes to 322% of the federal poverty level. They use Medi-Cal doctors now, so they get the same managed care packet, gonna get a BIC card. They get 12 months of post-pregnancy coverage. Again, if it's an emergency, it's gonna be covered. She needs to report immediately to her insurance that she's delivered out of network. And if you have issues, I'm going to provide you with the CHOI contractor list who can help troubleshoot. We're happy to help. So what does this mean for your clients? Managed care. All of your clients who have Medi-Cal or MCAP or Covered California, they're going to be in managed care. So I'm going to talk about Medi-Cal managed care. So when folks are first eligible for Medi-Cal, they're put in what's called regular Medi-Cal, fee-for-service Medi-Cal, straight Medi-Cal, right? These are all terms that folks use to describe how they are going to access their coverage. And they're going to use their BIC card, and we'll take a look at one in a bit, to access care to any Medi-Cal accepting provider in California. When you're fee-for-service, you can go to any provider in California. You're not locked into a network like people in a managed care plan. So since all of our clients are now going to be in managed care, we know that they're going to be on fee-for-service Medi-Cal for like a month. Very short period of time that they're going to be in managed care. So they're going to start in fee-for-service. A packet's going to come. Don't ignore this packet. Do your homework now. Do you have a provider that you like, that you want to stay with? You want to ask them, which Medi-Cal managed care plans is the doctor or provider contracted with? And because of the way payment flows in people who are in managed care, the state likes it because they pay a flat amount every month for that person's care, and that check goes to the health plan. And the health plan does not get any more money because maybe mom had a baby that month, and maybe it was a C-section, or maybe they had COVID and were in the ICU for 2 weeks. The capitated payment for Medi-Cal per enrollee is approximately $100 a month. So you'll see providers contracting with multiple plans, right? Because now they're trying to do in bulk, right? So maybe my OB is contracted with LA Care, Blue Shield Promise of California, and HealthNet. And so I'm going to ask, because I'm going to have a baby. So if I pick LA Care, where does my doctor have hospital privileges? Because contracting will be different for LA Care, for Blue Shield, for HealthNet. And I really do want to pick the hospital in which I deliver. So all of our clients with Medi-Cal now are going to have to learn how to work within a managed care system. Now, in LA County, we have what they're still calling it the 2-plan model. And we've had a little bit of a shift. So HealthNet has an administrative arm, but they also see clients. Molina is on their side, on the administrative side of HealthNet, meaning HealthNet can make switches between HealthNet and Molina clients. You don't need to go to Maximus, which is the state contractor, Healthcare Options, the people that mail the packet, the managed care packet. Now, last year, 2023, Kaiser was under LA Care, which is why I say 2-plan model. They're still calling it a 2-plan model, but Kaiser came out from under LA Care and is now kind of standing on their own 2 feet. So Kaiser now is an option on the choice form, but Kaiser has a rule that you had to have been their member within the last 12 months, or someone in your immediate family has Kaiser. So you still have to have a connection, but midway, so in June, I believe, or July, Kaiser is going to be put in the default algorithm. So let's say I got my packet, I didn't choose a plan, I'm going to get defaulted. They're going to auto assign me one. I can get out, got to call Healthcare Options, or depending on what side I'm on, and change. But now Kaiser will go into that default algorithm. So maybe they don't have a connection, but towards the end of the year, they're going to start accepting defaulted clients into Kaiser. So that's a little different. So managed care, using a network, right? Referrals. I saw there needing a referral to an OB. Is it being required? Is that what you're encountering? Now, because everybody's going to have full scope coverage, everybody's going to have comprehensive coverage, everybody, so that all started happening. This was, so notices and things went out to Kaiser members last year. So yeah, they received noticing, and I can share that later if you're interested in seeing it. I don't have it at my fingertips, but the beauty, non-medical transportation is covered. And it's covered in managed care. And when I say non-medical transportation, I'm talking about you just need a ride. So if I call 911 and the ambulance comes and they transport me, that's emergency medical transportation, right? Medi-Cal does cover that. We do see issues with hold on, I see a question in depth about defaulted clients. So clients need to select a health plan or they will be auto-assigned a plan, right? Maybe I wanted Health Net, but I didn't choose and they put me in Blue Cross. So I can get out, but because the way that my care is paid for, so if there's a 20th day cutoff, so if I make the change, so let's say this month, February 1, I wanted to be in Health Net, but they put me in Blue Cross. Today is February the 6th. I'm going to call Healthcare Options and say, I do not want Blue Cross. Can you please put me in Health Net? Because I made the change before the 20th of the calendar month, my Health Net will be effective March 1. If I'm trying to make a change, and Medi-Cal recipients can change every month if they wanted to. It's not strictly for being defaulted. But let's just say I called on February 21st and I said, I don't want Blue Cross, I want Health Net. Well, a payment is already going to Blue Cross because I missed the 20th cutoff. So I'm going to stay in Blue Cross for March, and I'm not going to get my Health Net to April. So now 100%, a packet's coming, checking in with your clients on, newly eligible. Did you just get a plan? I can provide the Kaiser information so that we can send it out. Yeah, because they have a kind of an expansive list of what qualifies. And there was a couple of things there that I didn't know. So we'll get that out to you. So any questions about this managed care before we move on? Luz, please.
Yeah, I put it in the chat, but can we do this change also for the Cover California consumers?
Do what change?
The provider, because this consumer was changed without noticing her, and then suddenly they just call her to just to say, okay, you cannot come to this clinic anymore. And also she was receiving in treatment in the City of Hope. She has cancer, and then she has to go back, and then they cancel her appointment as well. So it's kind of like I've been dealing with this Cover California for now a month and a half, and they cannot finish the change. They always give her another provider, and the clinic and the City of Hope is not taking it.
So maybe we need to look at specifically what's going on. So that might be something to refer to but I can work with you so we can at least figure out what's going on and how it can be helped. Because not the provider cannot be changed. Has she tried calling member services on her card and they're not able to help?
Yeah, we have. And then they said, okay, supposedly they did the change and everything because it was done without telling her. And
so
then
Luz, you know what I would do? Today, call member services. She calls member services. You can call with her if you like, but you're calling the health plan. File a grievance.
A grievance. I got
You
it.
say that, I want to file a grievance. She wants to file a grievance because they're messing with her care.
Yes.
She didn't ask for this, and you'll see they have 30 days to respond in writing, but bet you they'll fix it quickly.
Got it. Thank you so much.
Yeah. Thank you for your question. Okay. So I call 911. They send emergency medical transport. Medi-Cal does cover that. That's not what I'm talking about. Now, there is something called non-emergency medical transportation. So it's not an emergency, but there's a medical component to it. I need door-to-door service. Like maybe I'm in a wheelchair. Maybe I'm like connected to a G-tube. I'm getting dialysis and I can't ambulate, right? And so there is a medical component, but it's not an emergency. Non-emergency medical transportation, that requires a prescription from a provider. That's not what I'm talking about. What I want to talk about is client just needs a ride to access a Medi-Cal covered service. I don't have reasonable transportation to go visit my newborn in the NICU. I have a doctor's appointment. I'm in Anthem Blue Cross. It's for 2 weeks from now. I'm going to call this number. Some of these numbers are the direct transportation company. They're going to verify my Medi-Cal and they're going to arrange my transportation. So this is, I just need a ride. I don't have reasonable access, and taking, 2 buses is not reasonable access. Now, for pregnant clients last year who only had restricted Medi-Cal, they got treated as if they had full scope, but they were not in a managed care plan. So when we would have to arrange transportation, because pregnant people in 12 months post-pregnancy are eligible for transportation, we would have to email the state and say, I have a client who has an appointment on this day at this location. Bear information. Then they replied with an encrypted email. Now that everybody's in a health plan, client's just going to call the number that's associated with the health plan to arrange for transportation. Right? So it's a benefit. If you want all the info, this is a link to a fact sheet that we created that we have on our website that kind of breaks it down. So we should see very few people now in fee-for-service Medi-Cal. So transportation arranged through the health plan. Now that's even for some services that I use outside my health plan. We're going to talk about in a second. There are some benefits that are carved out. So I'm not going to use my Blue Cross card for dental, most mental health, substance abuse treatment, or to get my prescription drugs. We're going to talk about that briefly. So again, yes, transportation for kids, if it's a Medi-Cal covered benefit, yes. Pickup pharmacy, that is a Medi-Cal covered service. So Medi-Cal covered services. Yes, question.
Is there a limit as to how many times you can call?
No, there's no, and my fact sheet has all that info. There's no limit to distance. There's no limit to how many. What there is, I did want to mention, let's say the appointment is for a child, okay? Mom can accompany the child, right? Obviously, but it's for one appointment, it's only one child. So if mom has 2 other kids, they're not able to bring the other 2. They are picked up in, van, Uber, Lyft sometimes, taxi, right? And so they don't always have like car seats and things like that. So it's limited to the person who has the appointment. So that link will give you more information, and you can always reach out to me. I'm available for questions, or you just want to talk something out. Happy to help. Okay, Margarita, I will talk about that at the very end. So again, confirming in an emergent situation when the client calls 911 and the paramedics come, that is a Medi-Cal covered service. What the gray area is that sometimes these ambulance companies, they don't contract with Medi-Cal. And they can't predict who's going to go out in an emergency, right? It's who's available, so that sometimes is an issue because they're not contracted. You need to ask for the transportation with as much advance notice as you have. People get sick though, right? And I want to go to urgent care. They are supposed to try and accommodate you as quickly as possible, right? Because you didn't know you were going to get sick, right? And Medi-Cal should cover it. And if not, again, you want to reach out to the choice contractors because this is the kind of troubleshooting we do. Okay, cool. Transportation, don't forget, it's underutilized. Our clients need a ride. Let's not make that a barrier to get them to their visits, pick up prescription. And like I said, there are some benefits that are going to be accessed outside the health plan, and we call them carve-outs. So if I'm in LA Care, but I need one of these 4 things, I'm going to use my BIC card, my benefit identification card. And this blue and white one is the old school blue and white one. It works. Like 6-7 years ago, we had the 50th anniversary of Medi-Cal. And so California created this new BIC card with the California poppies. And then 2 years ago, they updated this BIC card to remove the gender markers. So male, female. So if you had a client who didn't want that gender marker on their BIC card, they could request a new one. So just FYI. So this card's important, right? I don't think folks realize. And many times if someone was on Medi-Cal and then they lost Medi-Cal, the state doesn't always send a new BIC. So maybe the client thought, well, don't have Medi-Cal, cut up the card. And now they're waiting for their new one to come. It may not come. So requesting a new one, right? Because checking, did you have Medi-Cal recently? Because what they do is just activate the old one. So I just wanted to put that out there. I think the delivery of prescriptions is going to vary based on where they're getting them prescribed. So there is a website that I'm going to get to that may be looking to see pharmacies that do delivery. Okay, so now we're talking about carve-outs. And I ran them all together for you. Substance abuse treatment, I don't need to be referred. I can call SAPC. It goes through the Department of Public Health, Substance Abuse Prevention and Control. The way it works is I call this number. I don't need a referral. I'm going to give BIC card information and I'm going to say, I need help. If they're able to, in that moment, they do an assessment of what level of care I'm eligible for. And that includes inpatient. It used to be 90 days. I understand it came down to 60 days. I don't know. And then like a half step out. Medi-Cal will pay for that. You can take a look here at their website to look at the different specialties they have, language, bed availability. They've got a search engine for different programs. So take a look. Medi-Cal covers it. We're going to use the BIC card. Dental. If we wanted to, could assign it to Access HealthNet or Liberty Dental, but it's voluntary. We don't have to. When that packet comes to choose a health plan, my LA Care, Blue Shield, Blue Cross, there's a booklet in there about dental, that can be ignored. It is my personal opinion that I feel better about DPSS because we've run into the dental plans putting their own rules, which have created barriers for kids sometimes to get access to care because they didn't want to send this young girl to a peds dentist specialist until she had 3 appointments where she was not cooperative. She had an abscess on her tooth, she was in pain, and that was the dental plan's rule. We call healthcare options, got her right out. So this is a search engine to find dentists that accept Medi-Cal. So I encourage you to take a look at that. Mental health is a little different. I'm going to access my higher level of mental health services outside my LA Care Blue Shield, right? But my provider, my primary care provider can do what they call the light, right? Mental health, low to moderate, can prescribe me antidepressant, anti-anxiety. Maybe I get 1 or 2 talk sessions, but anything that's higher level of care is carved out and it's accessed through the Los Angeles Department of Mental Health. They have an 800 line. It's a national hotline, runs 24 hours a day. They have about 45 people answering the phone. And prior to COVID, they were averaging about 850 calls a day. They say they don't turn away anybody for lack of ability to pay. So the way this service works is I call that 800 number and they do a quick triage, right? Are you safe? Is Liz safe? Danger to self, danger to others? No, I'm just good and depressed. Maybe I have postpartum depression. I've been crying for days. What they're going to ask me is, Liz, where do you live? I live in Highland Park. What's your zip code? Give me my zip code. They're going to give me some options of mental health providers in my area. Now, the county directly operates 11 sites. So staffed by county folks, but they subcontract with over 1,100 mental health providers. So they're going to give me one of those options. And the way it's designed is once I pick the provider, they send a message, and then that provider has 2 weeks to make contact with me to set up an appointment. Then they set up an appointment, which is not necessarily going to happen in that week. It could be another 2 weeks. So now it's a month, right? At my appointment, that's when they're going to assess me for coverage, treatment plan. So sometimes our clients can't wait, right, for that. So just some tips. If you go to their website, they have a provider directory to search, and all the county sites and a lot of the contracted sites have walk-in days. So I don't have to wait for them to contact me. On Tuesdays, they do intakes. Because of COVID, they're doing the intake over the phone, so I don't even need to go in there. Also on the website is navigators that they break out into 3 categories of young, middle, and then, senior, reaching out to the navigators to help fast track for your client, right? Again, Big Card is what's going to get things covered through the Department of Mental Health. And then our latest carve out, I think this is going on the 2nd year. Now, people no longer get their prescription drugs from their health plan. So 2 years ago, I was going to my LA Care. I was using my LA Care Blue Shield to get my prescription drugs for diabetes, hypertension. That changed. Now it's a carve out, and I use my Big Card. And here to find participating pharmacies, this is where I think you can find pharmacies that maybe have a delivery option, can take a look. There has not been a lot of problems. I was foreshadowing a bunch of issues and it didn't seem to happen. The formulary is on there to take a look at. So it is now our newest carve out using the Big Card to get medications. And I see Wonderful. Now, again, so do they need a referral to access mental health services through their Medi-Cal managed care plan? So I said it's going to be at the primary care provider level. They always want to work with their managed care plan, even when they're in need of higher level of care through the Department of Mental Health, because we want to alert the health plan that there's going to be coordination of care, right? Can they assign a case manager to this client? Is Medi-Cal managed care Medi-Cal coverage covered outside of the state or just in California? If it's an emergency, they will cover them throughout the United States. In an emergency, if they're in a health plan, but only for that emergency. This is a new one. This is another super exciting that so many more people are going to be eligible for Medi-Cal. So let's look at last year. Okay, so this is last year, 2023. So and it's called non-Magi Medi-Cal. It's the old school Medi-Cal. So who's eligible for this program? People that are over 65. This is the program they're screened for. Or if they're under 65 but are permanently disabled, so been disabled under the law and have Medicare. Having Medicare kicks them out of the other rules. So there was a second test for people over 65 and people with Medicare who were disabled. Now, the home that you live in that you're purchasing has always been an exempt asset. Now, if you were not living there, now it's not exempt. But if you're living there, it has always been an exempt asset. One car of any value, an exempt asset. And there's a dollar amount on what you could have in savings or any other property or resource that could be turned into cash. And for one person, $130,000, and for each additional member, $65,000. Now that's the resource limit. But let me tell you that in May of last year, it was $2,000 for one person, $3,000 for two. So it was super low. And if you're over assets, you get no Medi-Cal. It's not like being over income, where now your Medi-Cal's not free, you got to share of costs. Being over asset or resource would kick you out. Boom. No longer an asset test. It's gone. It is gone. So, well, no, they do need to report, right? They need to report it because they sign, when they apply for Medi-Cal, they're signing something that says that, I swear under penalty of perjury, all the information I've given is true and correct. It's an exempt asset, and now they do need to declare it, but now it's not going to be a factor. So now we are just going to look at income. Now, we made a little Medi-Cal house to kind of demonstrate the different rooms in Medi-Cal. We have one for pregnant people. This is our non-Magi that just got rid of that asset test or resource limit. Kids under 19 are pink, right? And so each room has their own rules. So another thing that was updated, and you'll see that the room color corresponds with the color here on this chart. Kids, pregnant people, this is our people over 19. And let me come back because Now, people confuse the asset test with, I don't want to get Medi-Cal because they're going to take my house. That is not the same thing. What they're talking about is a state recovery. The federal government says, if someone uses Medi-Cal for these two things, long-term care, and long-term care is not care for a long time, it's a place. This person is so medically fragile that it's unsafe for them to live on their own, and they're going to spend the rest of their days in this facility. Medi-Cal pays for long-term care. It's custodial care. It's room and board. They take all your money. That's your share of costs, and they give you $35 for your shampoo. That's long-term care. Or there are Medi-Cal waivers. So they waive rules. And one of them is spousal impoverishment, that one of the spouses is so sick that they would meet the criteria to be put in a long-term care facility for at least 30 days. The state saves money through this waiver by giving nursing level care at home through a waiver. So it's either I'm going to go live the rest of my days in this long-term care, and the federal government says, well, if that person used either of those two things at the time of their death, what was in their estate? And there are protections to protect the home. If they do have a home and they do utilize either long-term care or this nursing level care at home through a Medi-Cal waiver. And when I say nursing level care, I'm not talking about IHSS, in-home supportive service. That's not nursing level care. And again, it's always like a kind of confusing. Well, I'm going to break it to you in a second. I'll talk about that in a second. It's a lot, and these are the new federal poverty level. Now, I'm going to tell you, once we look at the different programs, that the state always lags updating the numbers. So potentially, if someone was right on the border, they could be screened ineligible. But what the state does is, once those numbers get put in, they go back and they rerun for people that were denied. So, but every year the federal government puts a dollar amount on what is considered to be living in poverty. It's related to the consumer index. I don't know how, I haven't figured that out yet. But so this chart looks at gross monthly income. This 100%, this is it. And these numbers are the same throughout the United States, with Alaska and Hawaii having slightly higher, but everybody else, we use these same numbers. So 100% for a family of 4, the poverty limit is $2,600. And before the Patient Protection and Affordable Care Act that hit in 2014, this was the amount for an adult that was not pregnant. It was at 100%. So Medi-Cal, knew that was not realistic. And so for people that are over 19, they're looking at 138% of the federal poverty level. If they're pregnant, there's a special room, and that's that 213. Remember I said some people get Medi-Cal only because they're pregnant. They're going to get 12 months post-pregnancy coverage, and then they're going to have to move. We want to make sure that these people who get Medi-Cal because they income qualify, did you report your pregnancy? We want to protect your coverage. And then kids, Medi-Cal really likes pregnant people and kids. Kids have more than 2 times the federal poverty level. They go to 266. So how I use this chart, family of 4, they come into my office, they have twin 15-year-olds, and they say, we make $5,000 a month. So I'm going to start with the kids because they have the highest income reach. I'm family of 4. The kids are under 19. And that income ceiling is 6,916. So the kids get Medi-Cal. But then let's look at the parents. Their income ceiling for a family of 4 is 3,588, like half. So interviewing, I'm going to ask, any changes to your household? And that's when mom tells me, well, you know, I'm pregnant. So what that does is increase the family size. Now we're looking at family of 5. If she had another set of twins, she would be family of 6, right? They count the unborn in Medi-Cal and MCAP. And now there's a special room. I'm not going to give her another set of twins. One's already, they're 15. She's got her hands full. So family of 5. Now there's a special room for pregnancy. So now mom's going to get Medi-Cal. Dad's going over to cover California. Right? So you can see how we could have multiple programs. Now, just want to point this out, that when a child turns 19, they're evaluated under this other rule. So you could see 19-year-olds losing Medi-Cal because the amount that they're allowed to earn has dropped dramatically. I'm not giving out this yet. I'm finalizing it. Like we just got it finished yesterday. And the state just put theirs up. I just want to compare numbers before I publish to make sure that, because sometimes rounding is, I just want to, we'll send it out to the group so that you guys have it. You know what? I lie. I sent it to you. It's in the material. So there you go. Yeah. When the material is sent out, it'll be sent to you. Okay. We said MCAP. Remember I said it's for people with higher income levels? Look at this, right? Higher income reach. They use Medi-Cal and they apply through the Covered California portal. Just want to make sure that folks know that that is there. And you cannot just look at this chart and look at somebody's income and figure it out. Why? Okay, so I'm going to go backwards. So Magi income. So Magi is the Medi-Cal that was created from the Patient Protection and Affordable Care Act, where you didn't have to have a link. We are using a tax formula, right? So when we do our taxes, our taxable income is adjusted gross income, right? AGI. But Medi-Cal always has an exception, and they say, okay, we're going to look at taxable income. Now, this is for people who are under 65. Taxable income plus you need to check to see, does your client have tax-exempt interest income, non-taxable Social Security benefits, foreign earned income, which will have its own IRS form, publication 2555. I have to add those 3 things in if my client has it into the adjusted gross income. That's why it's called Magi. Now, non-Magi, we just said, nope, not the tax rules. We're going to count all the money. But depending on where it comes from, we're going to treat it different. So if it's unearned, so this is for people over 65 or people that are disabled with Medicare. If they have Social Security, pension, or rental income, it's unearned income, we can only take a $20 deduction from their gross income. Now, if it's from a job, we're going to get that gross amount minus 65, divide by 2. That's the formula. No reason, no rhyme or reason why it's minus 65 divided by 2 anymore. I'm sure it was logical at some point, but so the calculations to get to income are different. So for you guys, Magi, right? Your people are going to be under 65. SDI, state disability insurance, right? That's when folks go out on maternity leave, they get that SDI. That is not taxable income. But if I stay out and I'm on paid family leave, that is taxable. So now Medi-Cal will use it in evaluating my eligibility, but I'm guaranteed 12 months post-pregnancy, right? Maybe I broke my leg. It's not related to pregnancy, right? So not all income is taxable. Workers' comp, not taxable. Child support, not taxable. I had to learn a little bit about the tax world. So it's confusing. There's a lot of exceptions, which is why I say don't just look at the chart and be like, oh, no, you don't make it. When in doubt, you want to refer to the CHOI navigators. I'm going to hit them in a second. They've been trained, and if they don't know any answer, they know they can come and reach out to the trainers at our agency, because it doesn't make any sense. All right. So we've been around for a very long time as a network. We have something called the CHOI database. And what it is a tickler system. So anybody that we enroll into coverage, we're going to follow them for a year. So we're going to screen them, we enroll them. I have 90 days to contact my client to see, did they get enrolled in the program that we submitted? And if not, I'm going to troubleshoot. We contact them at 6 months to encourage utilization of benefits. And then we contact them again at 11 months to get them ready for redetermination, because clients have a redetermination every year. Now, it was put on pause, and I'll talk about that in a second, but this is part of the materials. It's broken up by service planning area. I have a training contract through this, and so we provide technical assistance. We partner with Neighborhood Legal Services, and so our info is down there. And just some stats, we've been around, even some of us before 2003, but we've been doing this work as a collaborative for many, many, many moons, and definitely know how to navigate and help folks overcome the barriers. So totally reach out. Like I said, this stuff is so confusing. I was just telling folks earlier that I do once a month. It's 6 sessions, 6 trainings that are 2 hours each to dive in a little deeper. So what I want to quickly say about COVID is when a declaration of a public health emergency hit, what happened, what was supposed to happen, is that everybody's Medi-Cal benefits were frozen in time. So nobody should have lost their Medi-Cal or had a reduction of benefits. And when I say reduction of benefits, someone who's undocumented potentially had restricted Medi-Cal last year if they were between 26 and 49. While they're pregnant and 12 months post-pregnancy, they're treated as if they had full scope. So they couldn't lower the scope of benefits because benefits were frozen in time. So clients essentially went 3 years without having to do a Medi-Cal renewal. So they have been restarted. So I want you to, it started with people last year who had a June 2023 Medi-Cal renewal, because people have the renewals at the same time, right? So if my renewal typically happens in April, I have till this year for my renewal, so my benefits are continue to be protected. So it started with June renewals, we went June, July. So there's an 85 days, they do an ex parte review, and I'll go through that right now. If the ex parte review fails, then they're going to get a packet mailed. If they don't respond to that, they're going to get a 10-day notice. That 10-day notice is going to give the last day of benefits. So that's kind of the sequencing that this goes through. So ex parte, what it is basically using any information that is available to them before they contact the client. So are they enrolled in another program? Maybe they have CalFresh and they provided proof of income already, you know what I mean? Or when the Affordable Care Act hit, all of a sudden, there is the ability to ping against all these different federal databases, state databases, Social Security, IRS, EDD. So they're going to attempt to do that. And if they're able to do that, then the client doesn't have to do anything. They get a notice of action that says, hey, we checked to see if you still get Medi-Cal based on the information. You're going to have it for another year. We'll check in next year. That's the ex parte review, right? Where the client just gets auto renewed. So prior to COVID, we had a statewide average of 41% of ex parte renewal. So in average on the month, 41% were getting this auto renewal. It dipped to 25. So for November renewals, it was 25% statewide. Now I plugged this number in because in December, there are some federal waivers that are being implemented. That were being implemented that hit in December for December renewals. A couple of them that I remember off the top of my head, because there was a few, is if in my application, I declare my income, and they don't have a discrepancy that says I'm earning more, they're going to auto renew me. If my income is below 100% of the federal poverty level, they're going to automatically auto renew me. People who have had zero income, like folks like, let's just say who are homeless, these federal waivers allow for this auto renewal and some other stuff. But so look, when the renewals, these waivers were put into play, we just got our December. So people who had December Medi-Cal renewal, the ex parte rate jumped up to 66%. So that's encouraging, right? Because when it was 25% in November, that means that the county has to work 75% of the renewals that month. So good news. What else? If they are not able to verify the income, or based on what they're declaring, they're finding income in the system that's higher, it generates a form to go out. It's mailed in a yellow envelope, and the state says they're going to keep it in the yellow to try to, so folks are alerted, clients are alerted that the renewal is there in that yellow envelope. Now, clients can also use Benefits Cal, create an account. You have to link your case, and it takes like overnight for it to link. And then you could do your renewal via Benefits Cal. And Benefits Cal is our preferred way to do it because it is supposed to stop the termination path. So because the computer knows a renewal was submitted. So even if the county doesn't touch it, it's supposed to pause the termination. But this is the first time we're using Benefits Cal for renewals. It's a new system. We had Your Benefits Now last time. And I'm kind of skeptical in that I never believe it until I see it really working. So using Benefits Cal is supposed to stop the termination path. It may come in the mail, right? It'll have contact information. This is what we found. And you can put in there, no, I no longer have that income, right? And they're supposed to be able to take a verbal over the phone to also push through this renewal instead of the client having to send back proof. There is an additional phone call that has been put as one of the steps before they terminate. So again, all this was in an effort to keep as many people on as possible, because early kind of estimates were like between 2 and 3 million losing Medi-Cal when they started the renewals. So they put this in place. All is not lost though. So the state has to send a notice of action with a 10-day notice. So we just worked on a case where they didn't send this woman a 10-day notice, and they had to put her back on Medi-Cal. She's not eligible for Medi-Cal. So like next month she won't be because her income's really, really high, but because they didn't properly give her a notice, it's not a correct termination. They have to put her back. So there's a 10 days notice requirement. So if your client gets a 10-day notice, quickly either work with one of the CHOI navigators, or they can call the number on the back of that and ask for a state fair hearing, aid paid pending. What that does is put a pause on the termination. I got to catch it before I'm terminated. Aid paid pending says keep my benefits the same while we go to state hearing. So I'm not really going to go to state hearing because I know that I didn't turn in my redetermination packet, right? So if I can get whatever was missing within 30 days, they put me back on. And if I get that aid paid pending, I never lost benefits. So aid paid pending, I still have benefits. I call to file a state fair hearing. It's just an administrative process to pause the termination while I fix the issue. Now, if they cut my benefits, I have 90 days to fix the problem, and then they put me back on with no break in coverage. After 90 days, I need to reapply. This is the link here for state fair hearings. So definitely utilize. And my contact info, best way to get a hold of me is email, and I can arrange a time to talk. I work from home 3 or more days out of the week. And let me look now at the question. So that was a lot of information. And thankfully, you have someone to pass it off to. You can see how complicated this all is. Did you guys look at the income? Depending on where it's coming from and which program, there's different ways to evaluate it. You can see why our clients fall off, right? But the beauty is now everybody who's eligible for Medi-Cal is going to have insurance, right? That non-medical transfer, it's a game changer. And especially when we think about our older population of undocumented folks, like when the 50 plus hit, we started figuring out a bunch of problems because IHSS in-home supportive services, that is a Medi-Cal benefit, right? Medi-Cal benefit, but people were hitting obstacles because they were requiring either a social security number, where people undocumented may not, there might be a couple out there with the social, or an ITIN. And an ITIN, which is like a tax identification number, is not easy to get. And a lot of times they go to people who charge a lot of money for them. The long and the short of it is that they do qualify for IHSS, in-home supportive services. The county will ask them to apply for an ITIN, and we're watching it because the reason the state is doing this is because they act as an employer, right? So an IHSS provider is working for the Medi-Cal client, right? They're providing the IHSS for that client. So taxes and stuff need to be taken out of the check for the IHSS worker. So the state acts as kind of like the employment. And so that's why they request it. And so we've been working with other advocates because this shouldn't be a barrier. So I want you to know that it's a covered benefit. If you have problems, reach out to me. I'm happy to help. These are kind of things I like to get into, you know. So know that that's available. We do a core training every month. It's on our website. You can register on our MCH Access website on upcoming events. And my email is Liz R, as in Ramirez, at mchAccess.org. Thank you. And thank you so much. You guys, where were you when I had a baby? I was alone. My mom was in Vegas. I was the first of my friends. to have a baby, I could have used you. So I really applaud your work and all the extra support you provide. I'm sure you guys were just like angels during COVID, right? Having that reach, you know, in times where people were isolated. So thank you so much for all your work. There's more to come, right? We're going to send out some stuff to you, and keep in touch.
Thank you, Liz, so much. We greatly appreciate all the information. And thank you, everyone, for joining today. If you could please fill out, we put a link in the chat for a survey. If you could please make sure you complete it before you go, we would greatly appreciate it. Thank you so much, everyone, for attending, and stay dry.
Yes. I hope I get hot water. All right, you guys, take care. Bye.
Thank you, Liz.